Remember, just because I have a runny nose, does that mean I'm sick?
No.
You're right, Ethan. It doesn't. It means that my body is identifying that I have something there that needs to be eliminated. And flushing for the sinuses is through the mucosa. Please and please.
When you're dehydrated, can that cause a runny nose because the body's trying to hydrate the tissue?
I'm not familiar with that theory. The question is, if you're dehydrated, can you get a runny nose in an attempt to rehydrate tissues? My experience when I have had sunstroke or heat stroke has been that I get a runny nose. So I would say in theory, yes. I don't know the exact mechanism for that.
What do you feel about the benefits of like a neti pot or something like that when you're having that kind of congestion? Is that more helpful?
So the question is, what about some type of a washing of the sinuses with a neti pot or a water pick or something to wash? With a chronic sinusitis, yes. With an acute, not so much, okay? Here's the reason why I say maybe not, okay? When you look inside of the nasium itself, and you look up inside the nose, you have what are called nasal turbinates, inferior, a middle, and then a superior nasal turbinate. And those are actually created by what are called the nasal concha. In other words, there are little folds in there of membranes that as you breathe cause the air to kind of do an eddy, okay, which warms the air very quickly before it goes down the throat and into our lungs. Okay? It also moisturizes the air and helps us to smell and identify offensive odors or unpleasant things or risks or warnings. And it also then prepares the body to be able to utilize the oxygen further down. Now, the interesting thing about this is when you breathe, only one side is truly open or patent. Okay? Your body actually breathes through one nostril, and then when that starts to kind of dry, it actually moves the blood flow to the other side, causes these nasal turbinates to swell, and then the other side is open. Have you ever observed that?
Yes.
Sometimes one nose is more open than the other. Right now my right is more open than my left. Okay? Kind of interesting. Just do it real gently and you'll feel. Yeah? Kind of interesting, huh?
Yeah.
So by doing that though, often when we have the inflammation, these nasal turbinates will actually get swollen. And the swelling then may actually cause enough of a swelling that when you look at the person from the front, in essence, what we see is inside are these sinuses, the frontal sinuses, underneath the eyes are the maxillofacial sinuses, and then you have the sphenoid sinuses and the ethmoid sinuses deep inside. If you're running water in there, it may get in, but then those membranes might get swollen enough that it actually seals that off, and now you have water stagnating in there, okay, during an acute infection. Does that kind of make sense? So I don't always recommend nasal lavages or some type of an actual introduction of water forcefully or even by gravity. Whereas with the homeopathic, it's a mist. It stimulates the immune system and helps to activate the white blood cells in that area, chew up the naked proteins, run a little temperature, and get it out. Okay? That makes sense to everyone? Now again, if we're dealing with chronic sinusitis, that may be a different case. Right? But you kind of get the idea of how this works. Okay? When the upper respiratory infection then goes down the throat and I get a sore throat, remember the sore throat can be caused by bacterium. So the most common cause of sore throats are what? Yes, bacterial. It's called strep, right? Meaning of a bacterium, strep is the most common cause, or the one that we look most frequently for. And what's unique about strep is it will actually produce a little white exudate on these pharyngeal arches. So you'll look for something white, a little white plaquing on the arches. Okay? If it's red, it may be staph or it may be viral. So then you look all the way to the back of the throat, behind the tongue, and you'll actually see little viral blisters or little red dots at the very back of the throat. Okay, behind the uvula you'll see those little dots or little blisters, and when they say I have an itchy throat and they that kind of a thing, or it hurts to swallow, look for these. If you don't see the strep, look for these blisters and you know then for sure it's a virus. Okay? Great treatment for this, for children, something called carvacrol oil. It's the oil of oregano, and it's very, very effective at eliminating sore throats. Okay, it works great. It's an antibacterial, it's an antiviral, it's an antifungal, and it works very, very well. They can swallow it, just call it our pizza oil. Okay? What I like to do with that one is actually have a little glass of water. I warm the water, I put in a couple of drops of the carvacrol oil, it'll float, and then I actually will squeeze a half a lemon in there. Okay? And my little girl likes that one, and she'll just knock it down. Please.
My grandma, when I used to have a sore throat, used to put like warm salt water with a little bit of vinegar in it. I think the vinegar would cut the mucus and then the sodium would kind of help the sore throat. It seemed to work, but I don't know how effective compared to oil of oregano it would be.
Right. So Barb used to get something with a little bit of whiskey and
She never complained again.
Never complained again. She always had a sore throat. Just kidding. So when we look at that, there is, when you gargle with salt water, if you have a bacterial infection, bacteria have a cell wall and a cell membrane. Inside basically is a certain concentration of salts. Okay? When you hyperconcentrate salts outside of that cell membrane, and the body, this semi-permeable membrane is trying to balance its concentrations, what will happen is the turgor pressure inside will actually cause the cell of the bacterium to lyse or to explode. Okay? So you actually have a nice antibacterial in salt or a saline solution. So that's why we say rinse your cavitation with salt water. Don't suck or forcefully clean that out. We want to gently lavage that because that salty concentrate actually lyses or destroys those cells. So that's why it actually feels better too. Okay? The other thing that it does is when you said that she puts one other thing in there.
A little bit of vinegar to get the mucus.
Little bit of vinegar. I haven't done that one particularly, but it does help with the acidity of the stomach, which then is your first line of defense in your immune system against bacteria. Okay? When you eat something, it should be taking an acid bath in your stomach right away. Okay? So those are a couple things that we like to use. Carvacrol oil, which is oil of oregano, smells like a pizza. Tell the kids it's their pizza oil, and just use a bit. Okay? Don't burn them up. A couple of drops maximum. Or take a little bit on a Q-tip, try to swab the throat. If you actually even put a drop though on the tongue and they swallow, it's going to get back there without you having to try to swab and make them out.
With the Q-tip, I'd get it wet first,
Yeah.
just because
It'll absorb a lot.
so hot.
Yeah, it absorbs a lot.
Yeah.
Correct. So the recommendation there was maybe dampen or moisten the Q-tip with a little bit of water and then add the oil. Okay? So everybody clear on that to that point? Next herb that I really like that really helps with upper respiratory infections is something called andrographis. It's a product made by a company called MediHerb. Andrographis is just a real nice herb for strengthening immune system and helping to dry the sinuses. So I like this one, Andrographis complex. It works very, very well. Once we've gotten then an active infection in the lungs, I like another product called Pulmico. Pulmico is a very nice herbal preparation that also helps to treat the lungs, to thin the mucus, and to open up the airways. The other thing that I like to use is another homeopathic complex called Lung Terrain. So if you have had a cough for a long time, I like Lung Terrain just to help to heal that. Okay, and especially for the kids, when they can't swallow these big pills, the Lung Terrain is a drop, and it's very, very effective at helping us to reduce those infections. Okay? One other thing that I didn't mention with respect to the sore throat, topically, we can actually apply something that can help to reduce the discomfort of sore throat. It's a cream called Adrenastim. Some of you have used Adrenastim to treat your adrenal glands before, but this is a very nice formula that also helps with sore throats. The one thing you want to be aware of is if, as an adult, you're using that, it may cause you to be alert and it may create some difficulty sleeping, so don't apply it after 5 p.m. For your children, again, just use a little bit. The other aspect of Adrenastim is for a handful of people. I've been using this now for almost 6 years. For a handful of people, now 3, okay, in my practice, I've actually seen people get a rash from it when they apply it to the same area. Okay, so with your child, if you see a rash develop from Adrenastim, put it on the soles of their feet instead of their throat. But usually it's 1 day application and they're feeling a lot better.
Rub it on the outside.
Rub it on their throat. Yep, on the outside. Okay.